And they covered the vet bill, and I was like, wow, people are really, they will really help you.
What made you guys want to help these disabled animals? I think that's I mean,
What?
because like he was saying, we don't just throw away disabled people.
Yeah.
And and a lot of, I mean, I know we've talked about people feeling like animals are just disposable.
Yeah. So the clinic that I worked at for so long, and I've got to say the vets there were phenomenal. I mean, uh, they were such a good group that I'm prejudiced. I wouldn't want to work anywhere else. You know what I'm saying?
Yeah.
Like I wouldn't, I'm even a little funny about anybody else touching any of my animals because I know how they were and I know how good they were.
You know how they operate. You trust. It's like you have a trust
right. And I learned so much there. Dr. Hall was just like, he'd been in it for a long time, so he's like a wealth of wisdom, and Dr. Bars was just surgery. He was phenomenal with surgery. I mean, just, there's nobody else I would want doing surgery on mine. But so when I was working at the animal clinic, I'd always kind of had a big heart for, bulldogs. I was not a lab person. didn't care for labs too much, but everybody's got their favorite breed. So we're working there, and this lady comes in, and she kind of does what I did. She'd pick up strays, get them what they need, try to find a rescue to place them with. And so she came in. She had a mama dog and some puppies that she'd found on the road, and one of the puppies apparently had been hit by a car. It was tiny, very, very, very young.
The runt of the litter?
No, just like young.
Yeah,
just very young.
Right.
And his legs were splayed out sideways, and they were stiff. And she had taken him to a couple. I think she brought him somewhere here in Atlanta too, to have physical therapy to see if it would help him any or whatever. And they told her basically there was no help for his back legs. Right. So she brought him to the clinic, and she talked to the vets of the clinic, and they were basically like, there's not a lot we can do. He is paralyzed. He's paralyzed, in his back legs. The bones are already kind of fused together. There's not a lot to do. And so when she was it was really hard for her. She really did not want to put this dog down. I mean, I could tell that this was, she didn't want to do it, but she really didn't know what to do. And so I asked her if I could take him and try it, just try something. And so I took him home. And I talked to Dr. Bars about it, and Dr. Bars was like, maybe, we'll watch him and see what happens. And so I took him home. We made a makeshift wheelchair, like out of PVC pipe. It was
I've been there.
It was a mess. So, because we didn't know what we were doing. But anyway, so we brought Stevie home, and after about 3 or 4 months, it became apparent that one of his legs was going to have to come off. He was rubbing a hole in himself because one of the legs was drawn up, and it was rubbing, his butt.
Right.
So I talked to Dr. Bars about it, and really, I think he had never really, dealt with one in that kind of situation either. So he really didn't know how it was going to go, and he was like, well, we can try it, so we took one leg off, and we put him in a wheelchair. And shortly after that, the other leg started, giving us some problems. So we went back and took the other leg off. And Stevie, I just put up a post, and I contacted a place called Gunner's Wheels. They're on Facebook. They have been a godsend for us. So we talked to Gunner's Wheels, and they sent us a wheelchair. They do it through charity and donations.
Yeah.
And because we didn't know if he was going to live. We didn't know. And so we put him in the wheelchair, and I mean, he has had to have a few other surgeries. There's been some complications here and there, but I mean, he is a happy, healthy, big black lab. And he is, I mean, and he was the first.
Right.
And I think seeing that one that everybody else
kind of gave up on
yeah.
Yeah.
Seeing that and seeing that he could be a healthy, happy, normal dog.
Right.
Kind of gave me the push. I was like, okay, you know, these animals are the ones that need help. And you know, of course, having a vet that's willing to help you, even when they themselves are a little like, I'm not sure how this is going to go, you know, that is a big thing. You know, you have to, if you do take on one of these animals, you have to make sure that you have a vet that is on the same page that you are.
Right.
Because it is, you know, it's a strength. I'm sorry, I'm getting emotional now. Talking about my child, my Stevie child. But yeah, I have a good group of donors. And I realized pretty early in with Stevie, because the surgeries were expensive. I mean,
they are.
And you know, like I said, Dr. Barsh was great. You know, but he himself, you know, he had things he had to pay for to be able to do the surgery.
Right.
So I got together with my donors and just some people. I mean, I didn't know them at the time. And we started posting and they donated and they covered the vet bill. And I was like, wow, people are they will really help you. They will really help you with this. There's other people out there like I am about it.
They want to give that pet a chance.
They want to help. Yeah. And so I have a good group of donors now, and that's how we run. I mean, if it wasn't for them, we wouldn't make it. There's no way. There's no way that we could continue to help these animals without our donors, because it is expensive.
Right.
You know, and I think anybody that does take on a handicapped animal needs to understand that there are going to be expenses that you don't expect with a regular dog, you know, or a regular cat. So
it's always going to be something that might potentially pop up. And
yeah.
You're not prepared for it.
Sometimes you're like, what is this?
Yeah.
I mean, we've had some that we've had for years, and then something pops up and I'm like, what is that? You know, and so we'll have to go to the vet for it, and it'll be something crazy. I mean, it'll be something you won't even, I mean, like, okay, with Jasper, we knew he had a mega esophagus, but he was acting really strange.
The one on the very far left.
The first one, babe.
Yeah, that's it.
Yeah. He was acting really strange, and just because we were thinking, well, he's not getting enough vitamins. But when we had blood work done and all, he actually had Addison's disease too.
And cranial dysplasia.
Where did you guys get him?
Good night.
A breeder came to me.
A breeder came in and she had lost her
mother
dog, and she needed somebody to bottle feed the puppies.
Yeah.
And me and Mom both decided that, you know, we'd just bottle feed them for her. It wasn't a big deal. And Jasper was my puppy that I had to bottle feed. I think there's 6 and we both got 3. And Jasper was in that 3.
Yeah.
And I noticed
we were planning to return them to
return
right.
them.
Was he the only puppy that had like I guess like a disease or deep so
yeah, from a young age we would feed him and he would either puke or it'd run out of his nose. And early on we realized something was wrong, so we took him to the vet and found out he had mega esophagus. Not a normal case either, like she had explained, where the artery wrapped around. And then as he got older, with that in itself, I was told that he wouldn't make it out of his little infancy.
Yeah.
But once he turned about 3 months old, I think, he started acting really, really odd. And we took him back to the clinic to have blood work. And it turned out he had Addison's disease and cranial dysplasia. So
we didn't learn about the cranial dysplasia till he was about 6 months old.
Yeah, till he was about 6 months old, which is his head, his skull didn't grow, so his brain
was like pushing against this.
Yeah,
wow.
So it caused aggression. Wow. And the Addison's, it affects different parts of the body. It affected his kidneys and his eyesight. So You can kind of see he looks like he's squinty in that picture.
He always looked like that.
Yeah, he always looked like that.
Yeah, so she would feed him 3 times a day, every day, and she would hold him upright for 30 minutes because we didn't have a. There's something called a what's it called?
It's like a high chair for
It's a
dogs.
chair, yeah.
I don't know.
I can't remember what the name of it is.
Kind of forces them to stay upright.
Yeah, it's a high chair for dogs, basically. I wish I could remember the name of that thing.
But for me, I don't know. I didn't. I always held him whenever I fed him, so I didn't want one of those chairs. I wanted to love on him while we were sitting there.
That's the only time he was still.
It's like give you an excuse to like, oh yeah, I'm holding him up. I've got to do this.
Exactly.
Yeah.
But he learned. I mean, he learned. Knew. He learned that when he got ready to eat, he had to go and we had a table that we fed him at. And he would go to that table and he'd stand up right and he would wait, for us to feed him. So, I mean, he learned. And
it looks like he looks like he's pretty big. So he looks like he lived.
He lived.
He was a year old when he died.
Was he?
Yeah, I was told he wouldn't make it out of his infancy. When he got 3 months old, he's not going to live to be 6 months old. When he was 6 months old, he won't live another month. It was just constant. He's not going to make it.
And it was kind of crazy because once he hit that year mark, we kind of started getting comfortable. We were like, okay,
hey,
we're going to be fine.
Right.
Yeah.
And that's,
he died of embolism. Yeah. So, yeah.
See, that's why that is the main reason I feel for you guys, because